Beta blockers have been used since almost 50 years in the treatment of hypertension. A large number of clinical trials have been performed with these drugs and have demonstrated that they are quite effective in reducing morbidity and mortality in hypertension. In the last few years, some researchers have questioned the role of this drug as first-line choice for the treatment of hypertension. This was based on the results of a couple of large clinical trials, namely the LIFE study and the ASCOT study. However, an evaluation, a deeply evaluation of all the clinical trials have demonstrated that in most of them beta blockers resulted as effective as the other drugs, and also large meta-analyses have confirmed this. In fact, the LIFE study was a study performed in patients who had all left ventricular hypertrophy, and in this case the treatment with drug that reduce the activity of the renin-angiotensin system, such an angiotensin receptor blocker, is indicated. And in the ASCOT trial there was a difference in blood pressure that could explain also the difference in incidence of events. As far as total mortality, there is no difference at all comparing beta blockers with other antihypertensive drugs. But we have also to remind that some of the effects or unpleasant effect of the old beta blockers are not shared by new beta blockers that possess vasodilating effects, including carvedilol, celiprolol, and especially nebivolol. Nebivolol is a beta blocker with a vasodilating property that is related to the fact that it improves the nitric oxide availability as an antioxidant effect, and it may improve the endothelial function. This drug has been found to have favorable hemodynamic effects. The systemic hemodynamics are characterized by systemic vasodilatation, and they also may reduce central blood pressure contrary to the old beta blockers. In addition, it has favorable metabolic effects. There are no adverse effects, and sometimes it may also improve insulin sensitivity. In addition, beta blockers have been used also in heart failure, and in this context nebivolol have been used in elderly patients with heart failure, and it has been found that with this drug in the elderly it is easier to reach the target dose that has proven effective in reducing hospitalization and even mortality. In addition, this drug is a very selective drug, and it may be given also to patients with chronic obstructive pulmonary disease, according to recent studies. So, in conclusion, the new beta blockers, and particularly nebivolol, have peculiar positive effects that differentiate them from the old beta blockers and seem to be particularly indicated for the treatment of hypertension.